Hello beautiful people, and welcome back to Healthy Core, Pelvic Floor and More. I'm Dr. Kelly. I'm a doctor of physical therapy specializing in pelvic health, and in today's video we're going to talk all about the SI joint. We're going to talk about what it is, how you can tell if you have an issue with your SI joint, and if you stick around until the end, I'm going to give you 3 things that you can do to help to relieve your SI joint pain today. So if you're interested, stay tuned. We're going to start off by talking about the anatomy of the SI joint, also known as the sacroiliac joint. The SI joint is the joint that is formed between our sacrum and our pelvic bones. So I'm going to demonstrate on my pelvis here. You have the ring of the pelvis, which is formed essentially by 3 bones. You have the ilia, which are the 2 ear-like bones that are on either side of our pelvis, so they would be here on our bodies. This is what we usually call our hip bones. And then in between that you have the sacrum, which is a triangular shaped bone, and the joint between the ilium and the sacrum is known as the sacroiliac joint, aka the SI joint. Now this joint acts as a very important shock absorber for our bodies. It is held together by some very strong ligaments and muscles, and it affects our low back and our hips. It is very important to note that there is very little motion that occurs at the SI joint, so it's not often that it is implicated in low back pain. But one of the ways that you can tell if your SI joint may be involved is the type of symptoms that you're having. So oftentimes people who are experiencing SI joint issues will complain of pain in one or both sides of the pelvis. They'll complain of pain in the buttock, maybe even into the hip. They'll complain of pain in the groin, so somewhere right around this area here. But usually the pain does not go past the knee. SI joint pain is most often present during and after pregnancy as a result of the hormonal changes that need to occur in order for delivery to happen. We can also see it after a fall on the bottom, or it can be non-traumatic, so it can be a spontaneous thing that occurs without any precipitating issue. So now that you know what the SI joint is and how to tell if you have an issue with it, we're going to get started with the exercises to help to relieve your SI joint pain. Before we get going, you're going to need 3 things. First, you'll need a belt or strap, anything that is made of a material that is not going to give, so something rigid. Avoid using those stretchy elastic bands. You're going to also need a yoga block or a ball, also something that is not going to give too much, so a pretty firm ball if you have one. And then lastly, you will need a dowel, broomstick, golf club, whatever you have available. If all else fails and you have neither of these things handy, you can always use your hands. So let's get into these exercises. First, we're going to start by grabbing our yoga strap. I've already measured it to my desired length. So what I would do is just slide it above my knees, and then I'm going to lie onto my back. Now from here, I'm going to press my knees out into the strap. This is why it's important that you have a strap that is not flexible, that's not going to give, because you need something to give you that resistance. So I'm going to press into the band and hold it for a count of 5, and then I'm going to rest. And then I'm going to repeat that. I'm going to press into the band again, hold it for a count of 5, and then I'm going to release it. And I'm going to repeat that one more time. I'm going to press into the band, hold it for a count of 5, and breathing as I'm pressing into the band, and then now I'm going to release that. Now from there, we're going to do the opposite. So I'm going to grab my yoga block, and I'm going to put that block between my knees. Same thing, I'm going to press now into the block and hold it for a count of 5. And release. Press into the block again for a count of 5, 4, 3, 2, 1, and release. And one more, pressing into the block, holding it for a count of 5, 4, 3, 2, and 1. Now you could do this together, so I'm going to place the band back around my knees. You can alternate, I should say. So I'm going to put the band on the outside and the block on the inside. And I'm going to push out into the band, and then I'm going to alternate by pushing into the block. Now this is a little trickier sometimes, so you have to make sure that the block is in there comfortably, because then when you push out, it might fall out and then you end up having to chase it. But you may be able to hook it up in a way that it doesn't do that. So you would alternate by pushing out for a count of 5, and then resting and then pushing in for a count of 5. All right, so now for our next technique, you're going to need your dowel. So you're going to take your dowel, and what you're going to do is same position. You're going to lie onto your back, and I'm going to just demonstrate so that you can see how I'm positioning the dowel. You're going to have the dowel behind your left leg and on top of your right. So I'm going to lie down again onto the mat, and the dowel is behind my left leg and in front of my right leg. So now from here, I'm going to hold the dowel on either side, and I'm going to push forward with my left leg and pull up with my right leg. So it's this motion, but I'm going to stabilize it with my hands to keep it from moving. So I'm pushing with my left and pulling with my right. And just like the other one, we're going to hold for a count of 5, 4, 3, 2, 1, and release. I'm going to repeat that 2 more times, pushing with the left, pulling up with the right. 5, 4, 3, 2, 1, and release. And last one, pushing with the left, pulling up with the right. 4, 3, 2, 1. Now we're going to switch sides. So this time the dowel is going to go behind my right thigh and on top of my right knee. So again, it's going to be this motion. So we're going to push forward with the right and pull up with the left for 5, 4, 3, 2, 1. Release. Again, push and pull. 5, 4, 3, 2, 1. Release. And last one, push and pull. 5, 4, 3, 2, 1. Release. Now, if you didn't have a dowel available, I know I mentioned that before, if you didn't have any of these items available to you, you could always use your hands. So it would look something like this. Right hand will go behind the right knee, and then left hand will go on top of the right knee, or thigh, I should say. And you're gonna push into the hand that is supporting the leg. And then you would alternate sides. So then you would push into the right hand and pull into the left. And same thing, you hold it for a count of 3. Now, if you were doing the first 2 exercises, you can always place your fist in between, although that's a little bit more difficult to do lying down. And then you can also place your hands on either side to mimic what we were doing with the yoga strap. So you would push out into your hands. There you have it, my 3 favorite exercises to relieve SI joint pain. Let me know if these helped you out, and if they did, be sure to hit the like button and let me know how you did by leaving a comment down below. Thanks again for watching Healthy Core, Pelvic Floor, and more. Be sure to subscribe to my channel and hit the notification bell so you can get an alert every time I post a new video. And until next time, I'll see you back here on Healthy Core, Pelvic Floor, and more.